Welcome to the Zenix Hospital in-service tutorial video series. This series provides detailed information about the Zenix Defibrillator monitor and its functionality. These videos serve as an additional resource to formal training. Please take time to read the operator's guide available online at ZOLL.com. Obtain formal training from an appropriate authority before using Zenix for patient care. In this video, we review the external pacing features of the Zenix Defibrillator monitor. Zenix can provide demand or fixed pacing. This module focuses on demand pacing using Zenix CPR electrodes. To initiate external pacing, place both the 3-lead ECG and therapy electrodes on the patient and ensure they are connected to the device. Select Pacer mode. The Pacer dashboard appears at the bottom of the screen. Note, the Pacer is initially off. Use the plus and minus keys to adjust the heart rate. Once you increase the output milliamps, the Pacer will initiate, and the display will show Pacer on. Once the Pacer is on, solid white lines will appear on the ECG, and the letter P will appear below the marker. Increase output until capture is achieved. To view the underlying rhythm, select the 4-to-1 key in the Pacer dashboard. The Pacer will deliver 1 out of every 4 stimuli for the next 10 seconds, allowing you to see the underlying patient rhythm. Follow local protocols to determine capture. Once mechanical and electrical capture is confirmed, consider using the lock button to disable the touch screen. To discontinue pacing, adjust the output milliamps to 0, or simply return Zenix to manual mode. Zenix will retain the most recent Pacer settings until the patient case is over and the device is powered off. We have now reviewed the external pacing features of the Zenix Defibrillator monitor.